Well, hi, I'm Kara Pepper, and today is part two of a series on mast cell disease and what I'm seeing in my clinic with my patients. I will credit my patients as my number one teacher, as always. This is not the information that we learned in med school, and we are continuing to learn every day more and more about this disease and the overlapping syndromes that are with it. Last week was part one, which is what is MCAS and how do we even make that diagnosis? And today I wanted to talk very specifically about the things that provoke MCAS and the treatment for it. Um, uh, I think if we go back and look at this video 6 months from now, I will have more to add to it. And so there will be probably a part two as we move forward. But as best I know, this information takes care of probably 95% of the folks I see with MCAS. Again, I'm an internal medicine physician in Atlanta, Georgia. I see folks remotely and in my in-person office in Atlanta. I mostly do eating disorder care, but because of that, so many of my patients struggle with this triad of POTS, MCAS, and Ehlers-Danlos hypermobility. And so I'm sharing information on that. I also love taking care of perimenopausal women. And so now you know everything there is to know about my practice. A disclaimer, of course, I am a doctor, but not your doctor. Please talk to your doc about any of the information you heard today and get their best advice for you specifically. So a recap, a mast cell is a type of white blood cell that we all have. It circulates in our body. Here's a picture of one under an H&E stain. It gets activated by things in our environment that we come in contact with. And when it does, these purple blobs that are full of histamine and other chemical mediators get released into our bloodstream and create an impact on our bodies. This pictorial diagram of that is kind of a simulation of what you might expect. The mast cells are hanging around doing their business. They like to live in places that interface with us and the outside world, specifically sinuses, lungs, skin, GI tract, but they also love living around blood vessels and nerves and connective tissue. So once they get activated, they degranulate, they release all these little blobs of granules full of things like histamine out into our bodies. And before you know it, we've got this shower of chemical mediators that cause a reaction. And so what I want to specifically talk about is what are these, when a patient comes to me with these symptoms that we talked about last week, how does my brain operate? What do I think about and how I can try to get this patient feeling better? And it really pertains to these three components. Downstream, we often put people on things like antihistamines, which I'll talk about shortly, that will block the reactions to histamine in our body. But upstream, wouldn't it be nice if we never released those chemicals to begin with? So we can block, stabilize the mast cells here with medicines we call mast cell stabilizers. And then upstream from that, wouldn't it be great if we just never even had the provocation of the mast cells? So looking for triggers or provocative agents is a huge part of treatment of mast cell disease. So let's start with the first part, which is triggers. Like I mentioned, mast cells protect us from our outside world. So one of the most common things I hear from patients was, I was doing okay until, and there's usually an inciting event, although not always. Infections are very, very common, which is why we're seeing a ton of this in the wake of the COVID pandemic. So viral illnesses like mono, like COVID, like influenza, and others, particularly tick-borne illnesses. People will say, I went to overseas and I got traveler's diarrhea, and when I came back, I was never back to normal. So infections are a big trigger for the mast cells because they are part of our immune system. And then once they get activated, they start this cycle of symptoms. Any big emotional stressor that can impact our nervous system and our immune system, particularly trauma, is a big trigger for mast cell disease. And excipients, you will hear me talk about as we move forward, but excipients are like the filler of medications. We often think of a prescription you get from a pharmacy as being pure in the medicine that it's supposed to be, but there's filler that holds that together. Surprisingly, those fillers can be anything from gluten, dairy, like lactose, corn byproducts, other chemical mediators, dyes. All of those things can actually trigger the mast cells because they're reacting to that in your gut. And so interestingly, you'll hear patients say, I feel really sensitive to medications. Any medicine I take makes me sick. And it's often not the actual chemical compound itself. It could be the filler that's in there. So excipients are a big trigger. I'm recording this in July in Atlanta, so heat is a big problem. My whole practice feels like it's on fire right now. So temperature changes, particularly heat, but shifting from one temperature to another is really provocative. Sunlight and what we call photosensitivity. I saw a patient just yesterday who said, every time I go out in the sun, I get this full body rash, even under my clothes. It's the sun itself, which is provoking that skin version of MCAS. Fatigue and stress, easier said than done to get rid of that trigger, but when people overdo it, or they have a condition called post-exertional malaise, meaning I can go to the grocery store or I can cook dinner, but I can't do both because I'm totally wiped out. That degree of fatigue and stress on our body can be provocative. Medical procedures, particularly the chemicals that we come in contact with, medications that we come in contact with, off-gassing of paints and formaldehydes and anesthetic agents. There's all kinds of things that we can interface with in a hospital or medical clinic that can be provocative for folks. I even had a patient who needed their nasal cannula, the oxygen tubing to be, the package to be opened and allow all the kind of fumes come off of it for a 24-hour period before they felt safe to use it. Foreign bodies inside our body, so dental fillings, particularly metal, metal devices that could be like hip replacements or implants, surgical screws. Silicone is a big one. So silicone breast disease has been well known for a long time to be provocative. Even if you have a saline implant, the capsule, like the bag that the saline sits in, is made of silicone. So that can be provocative. And then a lot of medical devices like ports, tubes that go into your stomach, PICC lines that are IV lines into your arms, all are coated in silicone, so those can be provocative. And then weather, of course, anyone who has weather-related migraines can tell you this. Any weather change can be provocative. I mentioned dyes in terms of medications, but dyes show up in all kinds of different things. Often patients will say, well, I like Sour Patch Kids, but they make me super sick, but I knew I could tolerate chocolate. So dyes in foods. A lot of my mast cell patients have POTS, so they try to drink a lot of Gatorade or other electrolyte beverages, and they'll say, I just felt so sick after I drank that because there's dye in those products. Bath and Body Works and those types of perfumery stores are no-nos for a lot of folks because the dyes and fragrances are problematic. Mechanical irritation, we know about dermatographia. If you scratch yourself, you get that welt of red irritated skin, but people will often see it in clothing lines or after intense exercise. And then lastly, food and definitely alcohol. Now, I'm not talking about, hey, I had a beverage and or more, and then I felt hungover the next day. The typical story is I had half a glass of wine and all of a sudden I had a migraine, my joints hurt. I felt like I had a flu-like illness with an amount of alcohol that wouldn't particularly cause hangover type symptoms. And then air travel. Some people will say I can drive by car, but I cannot get on an airplane. And there's a lot of reasons for that. So these are just some examples. There are many, many more, but these are probably the most common ones that I hear about. And it can feel a little crazy making for patients to try to figure out what is the exact thing or series of things that tends to be problematic for me. In my experience, there's really no amount of medication that will ever overcome the triggers. So being very thoughtful about how can we protect you from contacting these things without making you live in a bubble. And that is probably the life work of trying to figure out how to adequately manage mast cell disease. So the first thing I ask patients to do is take a look back in your history, think about the things that you may find that you're avoiding. And what are some of those things that we can make some accommodations around so that you can live your life? Because that's ultimately what we're trying to do, is have full, healthy lives. I mentioned food, and as an eating disorder doctor, I want to be really clear about this. Understandably, especially at a young age, for people who are having these reactions, they'll say, I just never felt good when I had pizza if they're having gluten intolerance, or I never felt good when I ate strawberries or tomatoes because my mouth would tingle. Understandably, we start to avoid those things that are bothersome to us. And then before you know it, it can feel like we've restricted all kinds of foods, and then it may provoke weight loss, and then it may create a starving brain that becomes more anxious about foods. And so anytime I'm taking care of someone who struggles with both eating disorder behavior and mast cell disease, the mantra is fed is best. So if we're going to take something out, we need to replace it with fuel so that you are not starving your body in the process, because that eating disorder care and the experience of having an eating disorder absolutely will make the mast cell disease worse. So it's add in, not remove out. That's the mantra. But some of the big things that I think are modifiable in this way are, one, alcohol. There's no reason to drink except for the fact that we socially tend to like to do that. So there's no medical benefit to that. So removing alcohol, not just in what we consume by mouth, but in skincare products, in sprays, and in other things that we may come in contact with. Dyes, I mentioned earlier. So if we can eat whole foods that are not processed with dyes, that can be helpful. Leftovers, I recognize this is a place of privilege to be able to say this, but fresh food, particularly meats that have been butchered that day, are less histamine robust than leftovers that have been sitting in the refrigerator. We tend to accumulate histamine in foods the longer they sit out. So for folks who love to batch cook because it's convenient and cost effective, they may find that I felt okay on the first day, but by day 3, the food was really upsetting my stomach. So as often as we can, making freshly prepared meals can mitigate some histamine buildup in foods. If you need to batch cook, the recommendation is then batch cook, put it in individual portions, put it in the freezer to kind of freeze it in time, and then defrost one portion at a time as you move forward. These are some of the more common histamine-rich foods. So if some of these things you're going to avoid, again, make sure that you're adding in other foods that you can tolerate. And one comment about the animal proteins that are here, you see a lot of these like tuna and sardines. A lot of these things can be canned that we're, if you're buying it from the grocery store and not fresh. For folks who have nickel allergies, like they get skin rashes with certain types of jewelry, I do have a number of patients who react to the actual cans of food themselves. So again, buying fresh food when possible can help mitigate some of that. Okay, so step 1 is, what are the things that are driving your symptoms, identifying triggers and avoiding them when possible. So let's talk about what we do to stabilize mast cells and then block the histamine downstream. Let's talk about the histamines first. There's 2 different types of histamine receptors in our body. We call them H1 and H2 because we're not that creative in coming out with better names. The H1 receptors are generally in places like our sinuses, our airways, and our skin. So if you've ever had a sinus infection and your doctor says, hey, or allergies, and they say, hey, why don't you take a Zyrtec or a Claritin? This is why they're doing that. So that all of these medicines, the first 4 on this list, are available over the counter: Zyrtec, Allegra, Claritin, and some Xyzal. So these are things that on the bottle will say take 1 pill a day. If I have patients with chronic hives related to their MCAS or otherwise, they can take up to 4 to 8 of those a day. The limiting step is whether or not they're having sedation on these medications. So I find that the Claritin is least sedating, Benadryl, especially ones with red dyes, is most sedating, and Visceral. So I usually start with the least sedating ones and work our way up. Again, ask your doctor if that's appropriate for you, but you can take more than just one. And then the H2 receptors are in our gut. So if you've ever taken a Pepcid for reflux, this is literally what you're treating. Again, the over-the-counter dosing of Pepcid is 20 milligrams once a day. The prescription strength is 40, and I dose it twice a day. So you can take up to 4 of the over-the-counter ones as well. So blocking the H1 and H2 receptors is treating this downstream impact of mast cell disease, which can give people some instant relief while we're working on the causes upstream. And then the mast cell stabilizers itself, there are many, many, many of these medications. The most common that we know about that's been around for a while is Singulair, which is often used for allergies and asthma symptoms. There is a black box warning on this medication that it can worsen mood and increase suicidality. I see it on a fairly regular basis in my practice, and I think that's because I take care of people with a lot of mental health needs and I prescribe a lot of Singulair. So I think that's something to be aware of, and it needs to be counseled anytime a prescriber is recommending this medication. So the other complaint I may have about Singulair is that the pills are pink. So for people who are really sensitive to dyes, this one can be problematic. But for the people it works for, it works great. So Singulair is one. The second is a medicine called naltrexone. We've used this medicine for forever in the addiction space in the order of like 50 to 100 milligrams per day. It works on cravings for food, for alcohol, for other substances. But in low doses, 1 to 5 milligrams a day, it has this mast cell stabilizing capacity and pain relieving quality. So a lot of the pain docs are now using low-dose naltrexone for pain control. And I really like it for people who struggle with like achiness related to hypermobility and mast cell disease. This one needs to be compounded from a pharmacy, and a prescriber can send the prescriptions there. Cromolyn comes in several different formats. So one is a nasal spray. So love it for lots of nasal symptoms. It comes as an eye drop. So for people with lots of itchy eyes, you can use it as an eye drop. And it comes as ampules, like a little liquid that you can take by mouth. Cromolyn is not absorbed in the gut. It only works locally in the gut on mast cells. And so I love it for people with a lot of mast cell gut symptoms. But this is definitely a start low, go slow medication. I kind of have a love-hate relationship with it, because if you start at too high of a dose, it can actually worsen symptoms before they get better. So there's a lot of different ways to deliver Cromolyn, which is a mast cell stabilizer. And then ketotifen, again, this one can also be compounded, or you can get it by eye drops. So my kind of go-to starter package, if you will, is to put people on an H1 and an H2, and then usually a low-dose naltrexone for folks who can handle, we start those every 1 to 2 weeks. So you're not starting all the medicines at the same time, but that's a way to target mast cell stuff. I've commented here with 2 medications that are available by prescription. One is Xolair, which is an injection for people with really severe symptoms. This, particularly if you're having anaphylaxis or severe hives or eczema or severe food allergies, Xolair is a great medication. This one requires some finagling with insurance companies. And then lastly, imatinib, which is Gleevec, is often thought of as a chemotherapeutic agent. And for people with systemic mastocytosis, they've got the genetic KIT mutation that can lead to proliferation of these cells. This is not used for mast cell disease, but more mast cell proliferative diseases. You may see people on this. This is, I may have had 1 or 2 patients over years on this medication. This is not a common one, but it's available for people with really severe disease. All right. And then herbal supplements. You don't need a prescription to start any of these things. So quercetin is probably the most common one that we see people using. 500 milligrams tablets is how they come. You can take up to 4 per day. You can get this over the counter. L-theanine is another supplement that can be used twice a day. PEA, I love particularly for folks who are hypermobile and having a lot of pain symptoms. So you get dual benefit from that. DAO, or I can't remember the brand name that people use it for, but it's like a histamine digest is often how it's referred to. It breaks down histamine in your gut itself. So for people with a lot of food intolerances, that's a great choice. And then luteolin. So all of these are available without prescription, and it really is a trial and error process to figure out which ones are going to respond to the individual. A reminder, when the treatment is worse than the cure. I just gave you a whole list of medications. I do not think everyone should take all of these medications all at once at the same time. I mentioned that there's all that filler stuff that's in there. So starting these meds 1 at a time is super important. So if you're going to have a reaction to it, you know exactly which one is causing that problem. I am a huge fan of de-prescribing medication. So every time someone comes into the office, I'm like, are we sure this medication is working? When people accidentally run out between refills, I love asking about that window of time. I'm like, did you feel better or worse when you ran out of meds? Because if you felt better, it may actually be that what I'm prescribing is making you feel worse. So getting people off anything that they don't absolutely need is one of my favorite tricks to treating this disease. So again, we look for the triggers, we stabilize the mast cells, and then we block the histamine. If I've seen one patient with mast cell disease, I've seen exactly one patient with mast cell disease. And what I mean by that is everyone is different. If you were listening to this, there is no doubt that some of this stuff may resonate with you. Other stuff you'd be like, but what about? Yes, I know. Like there are so many different ways to treat this process, and not everyone is the same. Not everyone's going to have the same symptoms. Not everyone's going to have the same resolution of symptoms with medication. And I think that for me is the fun part about treating this disease, is that I get to actually listen to patients, figure out what works and what doesn't work, and find the perfect puzzle pieces to put together to help get better. If you have any questions, please feel free to send them to me in the chat or leave below once you're listening to this on replay. If you want to sign up for my email list or have questions about an appointment, you can scan the QR code or find me on my website, carapeppermd.com. I appreciate you being here, and I can't wait till next time. Next week, we will be talking about more mast cell related stuff, mast cells and eating disorders. So I hope to see you next week.